Welcome to Healthy Frontiers. My name is Dr. Bisogni. I'm a chiropractor, and this show is dedicated to the education of our viewers. Topic for tonight is preventing injuries on and off the field and the court. And my special guest is Dr. Ivan Hernandez. Dr. Hernandez is a doctor of physical therapy. His primary purpose in life is to help people live a life that is gratifying, and to obtain that gratification, one must be well. Dr. Hernandez graduated from New York University's inaugural Doctor of Physical Therapy program. He's a clinical instructor for New York Medical College's Doctor of Physical Therapy program. Dr. Hernandez opened his practice, Executive Park Orthopedic and Sports Therapy in Yonkers, New York in 2006. Currently, he's working on his first book, which will focus on 4 areas of wellness: financial, spiritual, mental, and physical. His speaking topics include entrepreneurship, fitness, health, performance, wellness, injury, pain, altered movement, stress management, weight loss, and empowerment. Dr. Hernandez continues to work with professional athletes, celebrities, as well as in integrating a unique brand expansion by working on a fitness column entitled Body Remix, which can be found on soulbounce.com. In June 2016, Dr. Hernandez received the Black Enterprise distinction as a BE Modern Man, and he is a recipient of that award. I'd like to welcome Dr. Hernandez to the show.
Thank you for having me on your show.
It's our pleasure. Thank you, Doc. So, Doc, let's get right into it.
Sure.
Okay, so why do athletes get injured?
You know, there are many reasons athletes would get injured: lack of preparation, lack of sleep, lack of hydration. But I think one of the things that is not so obvious is that previous injury is by and large the most robust reason why injuries occur. And there's a lot to be said about previous injuries. Yeah. Typically, when we have an injury, even after the complete resolution of an injury, after the tissue is fully healed, yeah, we start to move funny, and we move funny in very subtle ways, ways that aren't perceptible by even an orthopedist or a general practitioner. And generally, it requires someone who studies movement to analyze it and determine where, in fact, there's a motor deficit that would predispose someone to a future injury.
Sure. Great. So what is it about a previous injury, as you just spoke, that makes it a robust reason for future injuries?
Yeah, so what it is, you know, one thing is that a tissue could be not completely healed. So if there's inadequate healing on a local level, if that pathoanatomical location has not been healed, it hasn't gone through all the phases, a complete maturation phase of healing, then there's going to be insufficient tensile capabilities, tensile stress capabilities, and that ligament or tendon or muscle is going to be predisposed to injury. Yeah. That's addressing it from a local level. Yeah. But in a global, regional, interdependent manner, what we know is that when we have an injury, it often, and it's not uncommon to affect areas even remote to the area of the injury. Yeah. So if I sprain my ankle, yes, or my big toe, turf toe, or yes, an inversion sprain, which, sure, is common in volleyball, basketball, research has shown that it has demonstrated this concept of regional interdependence, where the hip muscles often become delayed in its activation. And when the hip muscles are delayed, it predisposes you to a slew of injuries: future ankle injuries, knee injuries, right, hip injuries, back injuries. Yep. So as a movement therapist, as a physical therapist and movement specialist, it is incumbent upon me to not only look at the local area, that ankle, for example, that the, yeah, athlete is coming in, but looking at the entire kinetic chain.
Yeah, very important. So let's talk about this kinetic chain.
Yep.
First of all, what is the kinetic chain? How would you identify that?
It's the kinetic chain is a series of interlinking parts, right, that have different regions with responsibilities for doing different things. And, yeah, if you were to look at the body and address it or categorize it with regards to what they're designed to do, the foot is designed to be fairly stable. Yep. The ankle is designed to be fairly mobile to allow for propulsion. The knee is I call it a modified hinge joint. It's, right, it's like a door. Right. So it's designed, although there's several other motions that are going on, for the most part, it bends and straightens.
Sure.
The hip is a fairly mobile and stable joint. The low back, the lumbar spine, is fairly stable. So these are the interlinking regions. And when you're addressing them from a rehab, prevention standpoint, or even performance, you want these regions, these interlinking regions, to do what they're designed to do.
Right, right. So one plays right off the other. An ankle injury, hey, my low back hurts, doc.
The hip bone's connected to the knee bone. The knee bone's connected to the ankle bone.
And that's where it's important for you to do a full case history on a patient who walks in, right? Hey, I sprained my ankle 8 weeks ago, but my back hurts. I'm here for my back, but wait a minute, right? Okay.
Yep, that's right.
So there you go. So let's talk about motor control.
Yes.
Exactly what is motor control?
So motor control oftentimes is erroneously thought of as strength, but strength and motor control are two different things. Strength is the amount of force that one can generate or absorb. Motor control is more, it has more of a timing element to it. So while your muscles could be strong, if they don't fire when they're supposed to, if there's a delay, then that would be an indication of aberrant motor control or abnormal motor control. So generating force is important, or absorbing force is important, but using the muscles in the time when they're designed to be used are equally important, because otherwise you subject certain regions of the body to stress. A great deal of research has shown that people, for example, with low back pain, athletes, even non-athletes, after sustaining a low back injury, it's not uncommon where there are delays in the small muscles that help to stabilize the spine. So in terms of rehabilitation, it's my job to look for these things, look for these aberrant motor programs that has developed after the injury, and treat it accordingly to prevent future injury.
Great. Okay, so what is that mobility, and how would you talk about that?
So like the low back is designed to be mobile, the knee is designed to be fairly rigid. Ankle is designed to be mobile. So when you're asking what is mobility, it's basically movement at a joint. And movement at a joint is based upon two primary things. The tissues that cross that joint, so the ligaments, the tendons, the muscles, and then the joint itself, what we refer to as the capsule, the tissue that's intrinsic or local to that joint that may either allow for normal motion or may impair normal motion. So if you were to look at the knee, for example, the capsule, the tissue that's localized to the knee, will affect the amount of movement at that joint level. But tissues that cross the knee, like the hamstrings or the quadriceps, those muscles will too, if impaired in terms of their length, will affect the mobility at the knee.
Right, great. So what is movement? You know?
Yeah, so that's interesting. You know, you would think this is movement, and it is. It's movement, you know, from a layperson's perspective, this is movement. But movement is a little more sophisticated than that, particularly in the eyes of a rehabilitationist. Movement is essentially what we just spoke about. It's the integration of the motor control and the mobility, working in harmony to create movement throughout the kinetic chain. So when you're bending down, for example, to lift something from the floor, or if an athlete is doing strength and conditioning and is doing squatting, the movement that it requires is that the ankle needs to be mobile. So the muscles that cross the ankle need to be flexible and extensible. The hip muscles need to be stable to prevent the thigh bone from rotating in or collapsing inward. The low back needs to be fairly rigid so that it can maintain this superincumbent weight stable on the shoulders and not round, because when that happens, the discs are predisposed to injury, herniated discs, things like that, among many other injuries. So movement is the integration of that, is what we see, but it entails multiple joints working
Right.
in harmony
There's
with
the word, huh?
doing what they're designed to do.
Yep, yep. Keeping that homeostasis in the body
That's
is that
right.
word, right?
Yeah.
Okay. So how do you treat movement dysfunction? Say someone's having a dysfunctional movement.
So what you do is you need to analyze it, and you want to analyze not only the patient that has symptoms or the client that has symptoms, but you also want to analyze the patient or client without symptoms.
Yes.
Analyzing the patient without symptoms would equate to what we call a screen. So before a season starts,
Yes.
you know, that athlete needs to be screened to make sure that they're ready for the upcoming season,
Yeah.
that they don't have any particular predispositions that may lend itself to an injury at
Yes.
some point in the season. So those are the things that
Yeah.
you want to look at. And the methodologies that I use are what's referred to as SFMA,
Yes.
Selective Functional Movement Assessment.
Yep.
This is after the fact, once
Yeah.
someone has sustained an injury already,
Yes.
once there's pain. And then there's functional movement screen,
Yes.
which is ideal for the athlete or client without any pain or injury, but that is looking to
Prevent it.
prevent it.
Yep.
And it's just usually prior to the season and at some point, several points periodically throughout the season.
Sure. Great. So just another question on that is, isn't it great for the kids to do this as well? I mean, to start out, not only professional athletes with whom you work, but kids in high school. And,
Absolutely.
I mean,
you know, I often tell parents and kids themselves that are athletes, the moment you step foot on a court or a field is the moment that you need to treat yourself as an athlete. And that requires strength and conditioning. That requires prevention via the analysis of the way one moves. Everyone has a different movement profile.
Right.
Like the way everyone has a different blood workup profile.
Sure.
And so while you may need certain vitamins to accommodate your deficits,
yes.
in movement, everyone with that different movement profile will require different therapeutic exercises to accommodate for their insufficiencies.
Perfect. Great. So outside of movement, what are some other considerations?
The ones that you would think are obvious. Getting adequate sleep.
Right.
That's critical. You know,
Sure.
you know, studies show that you're not as alert if your physical performance deteriorates when you don't have sleep. So,
Yeah.
you know, generally I recommend 7 to 8 hours of sleep, especially before a game or a heavy practice.
Yeah.
Hydration. We know that it just takes a small amount of dehydration to affect performance, as little as 1 to 2%.
Yeah.
And if you're thirsty, you're already dehydrated. So just drinking in anticipation of the event,
Yes.
during the event, and even afterwards.
Right.
Adequate preparation, adequate preseason preparation.
Yeah.
We need to prepare for an upcoming season. It doesn't matter if you're 8 years old or 10 years old. You can't just jump on the field and think you're going to perform the way you want.
Yeah.
Your body has to prepare for it, and so that requires some pre-season conditioning.
Yeah. And when you say preseason, I like to think about having kids, et cetera, you know, practice all year long.
That's
something.
right. That's
Even
right.
if in another sport, I mean, I don't know what your thoughts are on that. I mean, cross training in different sports.
Yeah, that's an interesting topic, actually.
know?
That's gotten a lot of traction recently in the sports arena, in the youth sports arena. But generally, I recommend that kids play multiple sports up until the age of about 14, 15, because you want to develop athleticism. You want to develop what we refer to as translateral development. And when you're playing one sport, you're developing your motor programs for that one individual sport. But when you look at the Wayne Gretzkys and the Michael Jordans and the Bo Jacksons, they were so athletic, and when you look at their background, they played multiple sports.
Yeah, for sure.
But yeah, you know, by the 14, 15, 9th, 10th grade, you could, if you really want to perfect yourself, you could start focusing.
Great.
But for injury prevention, definitely.
Great.
You know, a 9-year-old shouldn't think of himself as a pitcher exclusively. He's a kid that plays sports, but he should play multiple positions, let alone multiple sports.
Yeah, perfect. Don't be a couch potato in December and January either,
That's right.
Okay. Do you have any dietary recommendations, Doc?
Generally eating whole foods.
Okay.
You want to eat whole foods. You want to stay away from processed foods. And,
Right.
you know,
Just get
particularly
nutrition.
things with sugar, you know, things with a lot of sugar, things that are packaged. So I'm a big proponent of fruits and vegetables and good fiber and
Yep.
hydration.
Yep. And sometimes people need to hear that,
Yeah.
especially the kids. You know, it just, you have to hit it home with it.
It's
Yeah.
the gasoline that feeds the engine, so that we need the right fuel in order to perform well.
Perfect. So, do you, another topic altogether about fear. Do you think fear predisposes an athlete to injury? You know, they're fearful to get on the field.
You know, that's interesting. You need a little bit of fear. You need some level of stress. I think some level of stress is what will make you alert. It's what will make you prepared and bring you into this fight or flight state.
Yes.
Which is what you want before any battle. You know, if it's on the turf, field, court, whatever it may be, you want some level of alertness. But when it's overbearing and when it's not managed, it could immobilize you, it could paralyze you, and it could affect the way you move.
Sure.
And when you're altering the way you move, similar to what I alluded to earlier, that's when you're running the risk for injury. You want to be able to move fluidly, and when you're moving rigidly because you're protecting, you're being apprehensive, that's when things actually happen.
Yeah, great. So what are your thoughts about using social media while training? You know, do you need to be tuned into training, or there's some thoughts?
You know, I think social media definitely has its benefits.
Right.
I use social media.
Right.
Dr. Ivan PT.
Yep,
I use
there
it
you
all
go.
the time. That's on all the platforms. But I also I use it. But you generally, I want athletes and any gym goers or any exercisers for that matter, you want to be engrossed in the exercise. Ideally, you want to really be engrossed. And so, for the most part, unless someone else is recording you,
Right.
you don't want to constantly be interrupted with social media.
Yeah.
The more in tune you are with the activity, the more you will get out of it.
Yeah.
And you know that's my big takeaway
Yes.
when I'm
Talking
teaching about or talking about social
social media.
But it's fun.
Yeah.
I'm not. Don't get me wrong. I have a
Okay.
blast with it.
Yeah.
But you know, you just have to compartmentalize when to use it.
Right, right. Even someone just running, you know, say, and they have some headphones on, they're doing things, you know.
You know,
What do you think of that?
for a recreational runner,
Yeah.
sometimes you need to distract yourself.
Yeah.
And so sometimes it's good. It helps. It motivates you. If you hear that right tune, that right song, you know, it gets you going, and that's fun. As you advance as an athlete, though, you want to even disengage from that. Usually, you know, if you look at a marathoner and when they prepare, for example, they are completely in tune with their body. They want to know how they're breathing, their pulse, their stride. And in order to fully be engrossed with what's happening internally, you need to eliminate distraction. So it depends. If you're a recreational runner, by all means, and most people are.
Right.
Most people are recreational athletes. You know,
Correct.
what's the percentage of people that make professional sports?
Yeah.
But you know, if you're planning to be a high-end athlete, or if you are in that route, you really want to get an idea of what's happening in your body. You know, develop what's called intrinsic feedback.
Yeah, yeah, it'll tell you.
Yeah, and it'll tell you what you're doing wrong or what you're doing right.
For sure. Doc, what is the ideal mindset you should have while training?
You want to know that it should be hard. Unless it's hard, unless you're at the edge of your capacity, your body will not adapt. With the right guidance, you'll know what that threshold is. Certainly, you don't want to kill yourself. You don't want to develop rhabdo by doing too much, too soon, and too fast. But I think that, you know, if your program is tailored the right way and it's individualized, I think it's a great opportunity to push yourself to that capacity, to your threshold, in order so that you could adapt, so that you could get bigger and stronger and faster and improve your performance. And you have to know that when it's difficult, you got to persevere through it. You know, you got to have some mental toughness. Yeah. And you got to be confident. Know that the more you practice, you know, confidence doesn't come out of nowhere. It has a basis to it. And you know, one of the a strong basis to developing confidence, which is what you need on the field and the court, is practice. So you need to know that what you're doing while you're practicing is going to lend itself or carry over to when you're actually playing.
Sure, great. Discuss for us proper sleep and stress management.
There's not much to say about sleep. There's so many benefits of sleep that studies have shown in terms of cell repair and full recovery and improved cognition and being sharp, being on the top of your game. Ideally, I recommend 7 to 8 hours.
Okay.
For the most part.
Yep.
And maybe a little more for adolescents and younger. You know, probably closer to that 8 or 9 hours. Ideally uninterrupted. So, you know, if drinking before you go to bed makes you wake up at night, you know, probably fast from any fluids at least 2 hours prior.
Right.
So, you know, those are my big takeaways. And, you know, if you're going to take a nap, don't take a nap after 4 p.m. because generally that'll interfere with your night sleep.
Right.
Eliminate any technology. You know, try to. You want to start dimming down your lights. You want to put away the social media because you want to prepare your body for sleep, for the deep sleep that it needs in order to recover. In terms of
stress management, you know, person's really stressed out. And
you know, that's interesting. Athletes, non-athletes, I think just being human, we're all exposed to stress.
Sure.
It's the human experience. I think what makes stress important to consider when you're talking about the athlete is that when stress is overbearing, that too will immobilize you. That too will wreak havoc on your body. You know, it's, you know, cortisol, one of the stress hormones that's secreted when there's persistent and chronic stress, could have damaging effects on your performance. Overtraining syndrome.
Sure.
Athletes that train too much stop performing as well because they have this elevated stress hormone. So we need to control stress through exercise itself and then external stress, the stress that we have living this life.
So many people find that, right? That they start to exercise and they just take the stress away. You know, a big part of it rather than doing other bad things. Like
well, exercise is a great way to combat stress.
Yeah.
You know, my mention to overtraining is when you're not being guided and you're doing a little bit too much. That's when you can have the counterproductive effects of exercise. But all in all, I endorse exercise for everyone.
Yeah.
Whether you're 5 or whether you're 95, you should be exercising.
Great, great. So just before we start ending up here, Doc, why don't you just take us for a moment? I had a question. Okay, so you're a physical therapist. You know, everybody's heard of physical therapists. You're a doctor of physical therapy. So what is the difference? And then, well, just tell us what that is first. The difference between a physical therapist and a doctor of physical therapy.
They're the same. They're one and the same. You know, some of the education requirements changed in the late 90s, early 2000s. I was actually in NYU's inaugural class. One of the key distinctions with the doctorate level as opposed to its predecessor, Master's in Physical Therapy, is that it's a longer program. It's a 3-year program. And we're studying more. We're studying differential diagnoses. So if someone would come in with back pain, we need to be able to recognize that it's not perhaps a muscle problem or a joint problem. It may, in fact, be a tumor, God forbid. So we need to be able to examine and be able to consider differential diagnoses. Pharmacology is in the program. You know, America is dealing with obesity, and it's not uncommon where many of my patients are coming in with a slew of drugs. So you need to know how these drugs affect the human body with exercise, performance, and movement. So understanding that, and then radiology, that's one of the other ones. The reason why, I think one of the reasons that this doctoral level program has been created is because our mission statement has changed. We are experts within the movement arena. That's what physical therapists do. We analyze and treat movement dysfunction. And we also, many states, I think close to most states, last I checked, it was probably around 48 states in the country, had direct access. And basically what that means is that a patient, unlike years back, a patient can come to a physical therapist, can be evaluated and treated legally. 20 years ago, that couldn't happen.
Sure.
So it eliminates some of the red tape, the formalities.
Of having to be referred to.
There's one caveat though, and
Go
the
ahead.
only caveat is that certain insurances, in order to get reimbursed as a practitioner, require prescription.
Okay.
So although you could do it legally, if you want to get paid, sometimes you still got to go through that hurdle.
Got it. Got it. And just in the last 2 minutes, just tell us, I come to your office, doc, I have back pain. What is the procedure? Do you consult with the patient and diagnose?
Yeah, well, after going through the administrative procedures,
Yes.
you know, filling out the paperwork, you know, you'll be escorted into a room. I introduce myself. We'll go over a thorough conversation of your history, what led to your injury, or if there was one particular incident that led to your injury.
Right.
I will look at what I refer to as a pathoanatomical area. So if you're coming in, I'm going to honor that prescription. I'm going to look at your knee. Right. But I'm going to have a secondary diagnosis, and that secondary diagnosis is a movement dysfunction diagnosis.
Right.
So I want to know, because I know regional interdependence, the knee bone is connected to the hip bone.
Exactly.
So I'm going to look at that knee, but I'm going to see what else is going on in that kinetic chain that might either perpetuate that knee problem or may predispose you to a future problem.
All right, that's great, Doc. Hey, Doc, thank you so much for being on the show.
Thank you.
I want to thank Dr. Hernandez for being our guest tonight, and we look forward to seeing you on the next show. Good evening.